Begin with that scary headline of a new COVID wave in China. Bring in Dr. Kavita Patel, NBC News medical contributor, former White House health policy director during the Obama administration. Dr. Patel, great to have you with us. Can you put this wave in context, the XBB variant and whether or not, you would think that people, I don't know if the people in China have had COVID in terms of the penetration that we've seen here in the United States. So is there some sort of immunity or less immunity there?
Yeah, Melissa, a couple of things to put things into context. First of all, anytime you hear these kinds of numbers coming out of China, you do have to take it seriously. And we don't know if we've kind of seen the peak of what their cases are. I know those are predictions about cases at the end of June, but it's difficult to say. But suffice it to say, XBB is the circulating variant around the globe. And we know it's a more easy variant to give and to get. It's more infectious, if you will. And to kind of think about where China is right now, remember, because of the severe lockdowns, we have kind of an uneven immunity pattern. So we do see some of these reinfections, which is what we saw in the United States, people who have had 1, 2, 3, even 4, 5 infections, but not as many of the kind of broader-based vaccine-induced immunity. If you'll recall, they haven't had really mRNA vaccines in China. They've been using kind of older technology. And because of their lockdown policies, they had had a very different distribution of the types of people that were infected. So I think the critical things to look at: one, it would not be shocking, Melissa, to see an uptick in cases globally as well as in the United States. That could trail weeks to months. But the question is, are we seeing more hospitalizations? Are we seeing severe cases? And if we are, what kind of people? Is it older people, people who have never had infections, people who are not vaccinated? And then I think ultimately the reason you're seeing not just Moderna, Pfizer, other stocks trading up is that it's renewing calls for an updated vaccine. Even the vaccine that we have in the United States isn't the most current variant protective vaccine. So this is renewing the calls we've had in the country for some time now to have a much more updated vaccine, faster, and in a rapid dissemination fashion.
How would you gauge, and I know it's very difficult to do, what the public health response might be in China? I mean, they had COVID zero, then they completely flip-flopped on that. And at this point, we're hearing reports of sudden shutdowns of events, concerts, conferences, movie theaters, et cetera. Will that sort of containment work with this variant? Or do you think that they're just going to say, let it go, let's see? In which case, for us and for investors, the concern would be a shutdown of ports, a shutdown of manufacturing facilities, et cetera.
Right. The supply chain demands that we've been talking about for so long, that we know that China is kind of sitting at the center, and even the drug supply chain that's still causing problems around the globe. So I think, number one, we have to take a step and look at shutting down concerts and shutting down events. Certainly did not do enough in the United States. It was really kind of a three-pronged strategy. We really needed to put in better surveillance. We've seen that with wastewater. Something that's troubled me is that the China CDC, if you will, has also drawn back on its surveillance mechanisms, much like what we're doing, Melissa, in the United States, right? We're not doing as much of the monitoring, although we have some systems in place for wastewater detection, which can help see what variants are more current, what we're seeing in the United States. We don't have that necessarily in China. And so we have a kind of a blind spot. Shutting down a concert won't really do you much good if you have the virus in other pockets, which can spread easily. And we know XBB can. I think the second part of this is vaccination. We know that vaccination doesn't prevent transmission, but it can provide that really good layer, especially for the vulnerable. And then the third prong is treatments. And I think that's where, if the United States had to do something today to heed this warning, it would be to kind of make sure all three of those arms of the public health response are ready to be activated. I would like to think they are, Melissa, but I have to tell you, you walk around, the United States today, it feels like people have thought this is over. And I think the news coming out of China reminds us that this is not over.